Okay, guys, this is a long one, so buckle up. Pop quiz number 938. A client with a diagnosis of multiple myeloma is being treated with chemotherapy in the oncology clinic. After several months of chemotherapy, the client comes to emergency department because of confusion, muscle weakness, and diarrhea. A history and physical are obtained, and venous blood specimen is sent to the laboratory and ECG is performed. Which complications associated with chemotherapy does the nurse suspect the client's experiencing after assessing the client and reviewing the medical record? 1. Septic shock. 2. Tumor lysis syndrome. 3. Superior vena cava syndrome. Or 4. DIC. So before you guys answer the question, make sure you look in the patient's chart. Look at these lab results, look at the ECG results, and look at the physical assessment. Okay, so the correct answer, guys, is 2. Tumor lysis syndrome. And we got a couple clues that led us to this answer. So let me tell you what tumor lysis syndrome is, and then we'll go to the clues. So tumor lysis syndrome, patient has cancer and they're getting chemo or they're getting radiation. As those tumor cells are destroyed, if they're destroyed quickly, what happens is they release lots of purines and potassium. So if you take a look at the labs, you're going to see that the potassium is 5.8. Normal potassium is 3.5 to 5. And don't forget, potassium has a very narrow therapeutic range. Guess what? That's what's causing, look at the ECG results, the peak T waves, the flat P waves, the widened QRS complex. It's the hyperkalemia that's causing this. Let's keep going. Look at the hyperactive bowel sounds. That's the hyperkalemia. What's happening is those tumor cells are being destroyed at a very rapid rate. It's being destroyed at such a high rate, so much potassium is being released that the kidneys can't keep up. The kidney can't get rid of that potassium quick enough. So that's why we see hyperkalemia, and that's why we're seeing these clinical manifestations in the patient. So big sign and symptom to let us know what's going on with the patient was the lab results, was the ECG, but they gave us a hint. They told us that the patient has cancer and is getting chemotherapy.